All right, today is going to be a fun topic. We're going to talk about why at times do you cut your marketing budget and your ROI goes up. If you've ever had that happen before, there's usually a reason that that's happening, and we're going to jump into that today. And I think this will be helpful because this is hugely tied into your labor and to your average treatment acceptance on first visits. Now, this is a metric that most people don't measure or at least don't pay attention to. And it's really, really important. So let me just give you a scenario. You're spending $10,000 a month on marketing. Things are going along. And then you cut your budget down to $5,000. And then all of a sudden your ROI spikes. And what happens is your average treatment for first visit goes through the roof. So maybe it was at like $300 and it goes up to like $600, right? Or maybe it's at $500 and it goes up to $800, something like that. Typically what happens when you're seeing this kind of activity is you have been getting too many new patients from your marketing. And what's happening is you're losing too many opportunities. These patients aren't getting the treatment that they need. And people are leaving your practice really, really fast. What that does is it actually hurts your ROI overall because you're moving too fast patient to patient to patient to patient, you and your team. And so there's this sweet spot. Now everybody asks, where is the sweet spot, Gary? Like how many new patients, and it depends. It depends on multiple different things. Number one, it depends on the clinician and their speed, how fast they can do treatment or how slow they do treatment. And that has a lot to do with just experience. And then it also depends on your team's experience and their speed, right? So a dentist that's using an inexperienced team around them, it's going to be slower versus an experienced team. So that's a big component of it. But then it also has to do with the type of patients that you're working on. And then it also has to do with existing patients. Do you see a lot of existing patients? So a doctor who's experienced in getting 40 new patients a month and seeing a moderate amount of existing patients, might not be a big deal. If you're a brand new office, 40 new patients with no existing patients, that might not be enough to keep things busy. If you have a really busy office and you try to add in 40 new patients for one doctor, it might be too much. So it's like your office is this living, breathing organism. And it's really hard for an outside person, a marketing person, to tell you how many new patients you should be getting, because they would have to know all those components: your speed, your team skill level, and your how many existing patients that you're seeing as well. And so you have to look at all those things and create a recipe of like, here's where I want to be from a new patient standpoint. But one metric will tell you when you're leaving or entering the sweet spot, and that's the average treatment per first visit. Now, on the flip side, if that number gets too high, so if it starts pushing up and it's like 800, 900, 1,000 or even more, typically what that's telling us about a GP office is that you don't have enough new patients. You don't have enough opportunities. So you're capitalizing on a lot of the opportunities, but you just need more of them. So there is a sweet spot, and everybody's sweet spot's different. So I'd be curious to you, what is your new patient sweet spot? And when do you start feeling like you're kind of losing control and you're kind of losing patience? You're running patient to patient. You don't have the control, and you know that you're not giving the patients that you have there the attention that they need to make sure that they convert into treatment, that they accept treatment. Where's that sweet spot for you? I'd love to know. And thanks so much for tuning in. Hope you have a great day.